All right. Hello, everyone. Welcome to our next session to our Boosters and Beyond Addressing Key Challenges series. As you know, we've been going through the CDC's core infection prevention and control practices for safe healthcare delivery in all settings. And this week, we're going to be talking about risk assessment and appropriate use of PPE. PPE discussions and trainings have been done to death for the past couple of years, so we thought this week we'd have a nice twist to actually go over some case examples and solicit feedback from you folks to participate in the discussion. But before we get into that, we have our housekeeping items that we typically go through. So if you're not familiar with who the IPRO QIN-QIO is, IPRO holds the federally funded Medicare QIO contract for the 12 regions for CMS as shown here. Specifically, IPRO helps support New York, New Jersey, and Ohio. Health-centric advisors help support Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent helps support Maryland, Delaware, and the District of Columbia. Together, we are 3 organizations under the IPRO QIN-QIO banner. So if anyone asks if you're working with IPRO, you say yes. And with that, I'll pass it over to Mary Ellen to give us a COVID update.
Thanks, Josh. Hi, everybody. So hospitalizations are again down almost 13% this week with a 7-day average at a little under 3,000. Bivalent booster, we're at 53.9 million who have received the updated booster dose. That translates into almost creeping towards 42% of adults 65 and older who have received an updated bivalent booster. The latest variants, really XBB has been the dominant strain for several months, which is good news because it's been very consistent. They haven't seen too much mutating over the last few months, so that's good news. Next slide. And our NHSN snapshot of nursing homes that voluntarily report detailed vaccination, the up-to-date with COVID-19 vaccine for nursing home residents. It's pretty much stagnated at 53%, although I would suspect this data lags a little bit behind what real time is, but we're at 53% for up-to-date boosters with nursing home residents. So again, this is the really tough work with getting folks up to date with vaccines. And we'll continue to monitor this as well. Thanks, Josh.
Thanks so much, Mary Ellen. And at this point, I'd like to pass it off to Darlene to get us started with the CDC core principle of risk assessment and appropriate use of PPE. Darlene, over to you.
Hi, we're going to be talking about risk assessment, appropriate use of PPE. And we're talking about the CDC core IP principles. So this is what it says: ensure proper selection and use of PPE based on the nature of the patient interaction and potential for exposures to blood, body fluids, and/or infectious material, including gloves, gown, protective eyewear, face mask, or respirator. Next slide. For gloves, wear gloves when it can be reasonably anticipated that contact with blood or other potentially infectious materials, mucous membranes, non-intact skin, potentially contaminated skin, or contaminated equipment could occur. Next slide. For gowns, wear a gown that is appropriate to the task to protect skin and prevent soiling of clothing during procedures and activities that could cause contact with blood, body fluid, secretions, or excretions. Next slide. Protective eyewear. Use protective eyewear and a mask or a face shield to protect the mucous membranes of the eyes, nose, and mouth during procedures and activities that could generate splashes or sprays of blood, body fluid, secretions, and excretions. Select masks, goggles, face shields, and combinations of each according to the need anticipated by the task performed. Next slide. Removing and discarding PPE. Other than a respirator, remove and discard PPE before leaving the resident room or the care area. If a respirator is used, it should be removed and discarded after leaving the resident's room or care area and closing the door. Next slide. Other key points. Do not use the same gown or gloves for the care of more than one resident. Remove and discard disposable gloves upon completion of task or when soiling soiled during the process of care, and do not wash gloves for the purpose of reuse. Next slide. Training and competency. Ensure that healthcare personnel have immediate access to and are trained and able to select, put on, remove, and dispose of PPE in a manner that protects themselves, the resident, and others. Next slide. Did I tell you I was a mind reader? Let's go to the next slide and see if I know what you are thinking right now. Yes, we know, we did that. We had the in-service signatures. But here's the important part. Next slide. Have you trained everyone in why to use PPE? Are you sure that they understand and practice infection control principles? Will they be able to use critical thinking to make decisions about when to use PPE? Next slide. So what we're going to do is offer some scenarios for you to think about. What I would like you to do is open your chat and be ready to put a Y in the chat if you think the staff person is getting ready to do something that will spread infection, or put an N in the chat if you think what they're going to do is okay. All right, is everybody ready? Next slide. So here's your scenario. The resident in the bed closest to the door of a 2-bedroom has been placed on precautions for C. diff. Now, the best case scenario is that they're in a private room, and the second best next case scenario is that they're in a room sharing the room with someone else who has C. diff. But in this case, the other person in the room has no infections and no open areas or lines or tubes. All right, the above the bed light is not working for the resident in the second bed, the one with no infections and no PPE requirements. The maintenance person enters the room without PPE to replace the light. As the maintenance person is leaving the room, the resident in the bed by the door, the one with C. diff, asks the maintenance person if they could pick up the TV remote that has fallen on the floor. Okay, here's your chance. In chat, is this a Y or an N? So we have a couple of people who are saying no, that the maintenance person isn't going to be doing anything that would spread infection. Now we're getting some Ys.
So a couple of Ys now.
Okay, so if you were on the presentation that we talked about environmental cleaning, you'll know that our guest presenter was very specific about the TV remote being one of the areas that is frequently missed for cleaning, that is most likely to have infective agents on it because the person with the infection is using it and it's sitting on top of the bed and close to their upper body for respiratory infections, but could also have other infective agents on it. So what could the maintenance person do what is the maintenance person to do? Are they supposed to say, no, we're going to leave it on the floor until a nursing assistant comes in the room? What could happen? You can come off mute. Anybody with a good idea? I know Mary Ellen already has a good idea.
Well, I would say that if you could signal to someone to come into the room with PPE on, that would be ideal, but I don't know if it's the best answer.
So that is one answer. And remember that we're not talking about a light bulb here, a little bulb. We're talking about one of those long lights that the person is carrying out of the room, that they could say, I need to leave the room, I need to take care of this first, and then either come back in the room with PPE or send somebody else back in the room. But picking up the TV remote and handing it back to the person is not the right answer. But did somebody tell them that in the education?
Yeah, that's a good question, Darlene. I mean, situations like this, they may think that they're not going to, spread any infections. They're going to go specifically, address something for the other resident with no infections, with no PPE requirements. But we know that C. diff spores are one of the hardest things to kill. And those high touch frequency touch items like the TV remote, even the light switch for the room, a lot of the folks even forget to even address to clean those things. So at the very least, the maintenance person should be able to put it on a pair of gloves to pick up the remote for that resident, and then dispose of those gloves before leaving the room.
And I would add, Josh, too, at the very least, and that's really important, to limit his picking up spores on his hands, is hand hygiene before and after, at the very least. At least, we know his hands are most likely going to be contaminated. So not the most optimal situation, but certainly something he could do to minimize transmission.
Okay, let's try another one. So the nursing assistant knows the resident is on precautions requiring gloves, protective eyewear, and face masks. Mike says all staff. The nursing assistant appropriately puts on all PPE and enters the room. The nursing assistant looks for the washcloth that was in the room, but now the nursing assistant cannot find it. The nursing assistant leaves the room, still in PPE, to get another washcloth. When questioned why the nursing assistant is in the hallway in PPE, the nursing assistant states, "I haven't touched anything yet, so it's okay." What about this?
Yes or no? Is this person at risk for spreading infection?
Okay. The bottom line is you have to assume that if somebody is in the room with PPE on, there's something on the PPE and they shouldn't be coming out in the hallway with it. And I imagine that everybody on the call can say, I think this has happened to me before, where I'm the one saying, why are you in the hallway with gloves on your hands? Or why are you in the hallway with that gown on? And it could have been that they just got the gown on and realized that maybe the washcloth fell on the floor. Maybe they just can't find it, or they can't find something they need in order to provide care. And they don't want to take it off because they don't want to waste it. Because that's the other thing that I've heard. Well, I didn't want to waste the PPE.
Yeah,
Mary Ellen says any staff have potential to, and I didn't read it all. It's gone.
Oh, I was going to say, just commenting that, yeah, it's great that if you include all staff in your education, because, anyone can enter that room for whatever is necessary, clinical or non-clinical. And I think sometimes people forget about folks like the maintenance who, it's Murphy's Law, they're going to go into a room for some reason and the resident is going to ask them to do something that they weren't necessarily thinking they would have to do. But I was also going to say with walking out of the room, you can't presume that you're not contagious, even if you have not touched anything. And OSHA's stance on that is pretty firm, that any PPE outside, if you're walking around PPE outside the room, is considered
right.
hazardous.
Right. And sometimes when they say I haven't touched anything yet, they mean they haven't touched the patient yet, or
right.
the resident. Not that they haven't touched the bedside stand, the doorknob, the light switch, who knows what else. But anything is a kind of vague word. And Samantha said, don't forget about the agencies.
Yeah, I think these scenarios are really helpful to go over. All too often, I mean, we've done PPE training for the past several years now with COVID, and everyone's tired. There's PPE fatigue. Everyone's tired about learning about it. There's everyone's signed off on all these trainings, but the critical thinking component behind it, making sure that your staff are, really have a grasp of understanding why they needed wear PPE and for scenarios like this and what they should and shouldn't be doing, I think is taking that PPE education to the next level.
Okay, let's go to another one. The resident has an infection of the lower leg and foot, requiring gloves and gown while caring for the resident. The resident also had symptoms of COVID-19 and was placed on precautions. It's now 2 weeks later and the COVID-19 precautions have been lifted, but the infection of the lower leg and foot persists. The social worker is in the room to do an update for the MDS. No PPE, the social worker is just asking questions. The resident asks the social worker to position the resident's shoes so that the resident can slip into the shoes in preparation to transfer to a chair. Yes or no? Yes, it's a potential spread of infection, potential for a spread of infection, and no, it's okay. Yes, yes. So here, everybody's saying yes.
Yeah, some more yeses.
Here's one where one set of precautions were lifted, but there's another set still in place. And while everybody's got their mind on COVID, you need to make sure everybody knows that the person could have COVID and something else going on at the same time.
Yeah, Darlene, I think the COVID-19 here is sort of like a misdirection for this case example where, you know, we've been so accustomed to, you know, focus all our energy on COVID precautions, but that infection on the lower leg and foot requiring glove and gowns to care for the resident, the social worker, you know, at the very least, shouldn't even touch the shoes without even putting on a pair of gloves, because you have to assume that those shoes potentially are a source of infection and germ as well. And like Mary Ellen was saying, you can never go wrong washing your hands. So whoever has gone in the room and touched anything should be washing their hands after the fact to make sure that they're not spreading anything.
Yeah, you're right. I mean, minimum requirements for standard precautions are washing your hands before and after. So, you know, this is sort of, when we had talked about standard precautions a few weeks ago, this is where it's so important just to do a quick risk assessment. You know, the shoes could be stellar. I'm going to be positive and say they're perfect. They're brand new. And, you know, if she touches the shoe, you know, moves the shoes to a position where the patient's able to slip into them later, it's not really required to have the gloves on, but the requirement is that hand hygiene before and after to minimize the risk of any potential germs that are on the shoes. However, you know, if they're not looking so hot, or, you know, gloves are certainly an added benefit. So I would say you would have to look at your risk and say put on a pair of gloves, but don't forget the hand hygiene.
Okay, let's try another one. The resident was admitted with a diagnosis of C. diff. The resident is eating meals in the resident room. The resident's meal tray was missing at the noon meal tray delivery, so a dietary aide has brought the tray into the room, or to the unit. The dietary aide thinks it's okay to just put the tray on the overbed table in the room since there won't be any direct resident contact. What happens if the dietary aide has to position the overbed table? Is this a potential for yes? What do you think?
A lot of yeses.
A lot of yeses.
Isn't this Murphy's? This is a Murphy's Law case. You know something's going to happen.
Right. There's no way that they could just, well, there could be. The dietary aide could just walk into the room and put the tray on the overbed table and leave and not touch anything. But that's a rare chance that they're not even going to have to position the overbed table up, down, change it a little. And they should be, Joanne's saying, should be wearing appropriate PPE. That's right. Some facilities won't let the dietary aide go into a room an isolation room at all. So it just depends, or a room that has precautions.
Yeah, I mean, we're talking about C. diff here, something that spreads very easily in the facility. The dietary aide may think that they can just go in and plop down the tray, but all of us, I think, can agree that as soon as a resident sees someone come into their room, it's not just going in for that specific task. They have X, Y, Z things. Can you grab my sweater, put it on the chair? Can you get my TV remote? Can you get me a box of tissues on the other side of the room? There's so many, the residents don't have many care interactions during the day. So when they get someone, they really want to maximize the opportunity of making sure that they have everything that they need before they leave, that individual leaves the room again. So in this instance, like Joanne said, this person, this dietary aide should be wearing all that appropriate PPE, because they're not going to go in and just do that one task, because the resident's going to need something, and it's better to make sure that they have the appropriate PPE on in case they need to be touching anything else in that room.
Okay, let's go to the next one. My favorite one. This scenario occurs during the annual facility survey. You receive a message that the surveyor wants to talk to you in a resident room. You go to the room and note that there's a sign posted that gloves, gown, and mask are required when entering the room. The surveyor's in the room and says to you, "Get in here and look at this." Will you remember to put on PPE before you put one foot in the room? And by the way, what do you do if the surveyor is not wearing PPE? Is this a problem?
Oh, yeah.
And they're saying correct the surveyor. Yep. It's a setup.
Respectfully informed surveyor.
Right. Yeah, we had a discussion about this for a while, because do you hand them PPE to put on? Do you tell them they need to wash their hands before they start putting the PPE on? Yep. You need to speak up, and you need to say something. And specifically, if they don't have the PPE on, you need to talk to them about what room do you think you're going to go into next? Mm-hmm. It's a concern.
Who's brave enough to walk them out is what I want. Really, they should be leading by example. I know that, I'm being Pollyanna-ish, but, we've had instances, not necessarily a surveyor, where somebody blatantly ignored the PPE requirements and ended up having to be walked out, because you have to consider this, and no disrespect to the surveyor, because they could have seen something and not thought it through before they went in the room. But where are they going after that? And even visitors, this brings up a point with visitors who don't do that, is that you aren't always in a position to police them because you're so busy, but they need to go, from point A to point B without going in common areas where they have the potential to spread something because they didn't follow the PPE requirements. So this is a tough one, Darlene, because you're in a tough spot with a surveyor in the room.
Right. Pamela said to have the DON have that tough conversation with the surveyor. If we're talking to the IPs, let the DON do it. Next scenario. The resident has an infection requiring gloves, gown, and face mask. You've counseled the resident's wife about wearing appropriate PPE while visiting, watched her put it on, watched her remove and discard the PPE, and watched her complete appropriate hand washing. She's got it down. There's a sign at the door that states all visitors must go to the nurse's station first before entering the room. You look in the room and someone you don't recognize is in the room without PPE. So it's not like it's a resident who has dementia that wandered in the room. You would recognize that person. This is someone you totally don't recognize. what do you do now? Now, this is, again, what Mary Ellen was saying. This might be the person that you need to walk all the way out of the building to make sure they don't go anywhere else.
Yeah, I mean, if this person is a visitor, you got to think, okay, they may just be in this room without PPE, and then what happens now where if they go use the visitor bathroom, or what happens now if this person goes into the food pantry and starts touching things? This is definitely a big issue that needs to be addressed.
Or what happens now if they go into a dining room or into an activity where there's other people there? There's all kinds of issues. But if it's a person who's going to be coming back into the building, then maybe you should make sure that this person has some kind of infection control education.
Yeah, Stephanie shared that that they would say something to the individual.
Okay, let's try one more. I think we missed one. I think there's a 7, or did we lose it?
Let me check.
That's okay. Well,
sorry, let me put it back. Here you go.
Yeah, that's okay. But I just had one more, that there was a person who had C. diff, and the person was discharged to home, and all of the person's belongings were taken home.
I got it right here. Here you go.
Okay, great. And then all of the belongings are gone, and the linens have been removed from the bed, and the nursing assistant took the precaution signs off the door and removed the PPE cart. The housekeeper who had been cleaning the room during the resident's stay finds gown, goggles, mask, and gloves, and cleans the room with the bleach solution or the sporicide. Now, what do you think?
She's an astute housekeeper.
Somebody who knew what the rules were and followed them. So the problem was the nursing assistant who took the precaution sign off the door and removed the PPE cart before the room was terminally cleaned.
Yeah, removing that signage, it doesn't give the indicate unless they're have a way of communicating that. Once the it's obviously a big issue because the housekeeper would go to that room and not knowing what type of cleaning needed to have been done based on the the resident's infection. So definitely a big issue. I think, Darlene, you mentioned that at your facility, the housekeeper themselves were the ones to remove the signage after
the housekeepers were the ones to take the sign off and remove the PPE cart after terminally cleaning the room. Mm-hmm. Stephanie says re-education of staff. Yeah, somebody would have to really talk to the nursing assistant and say, no, that's not what you need to do. Can you put the housekeeper at risk?
Right.
And remind them that the next thing that they would do would be go into another room. Oh, you PPE in the room and not in the hallway. Well, the PPE cart, in this case, I'm sorry, I didn't write that. The PPE cart was actually outside of the room, and so was the sign on the door. So they probably just took the sign down, put it on the cart, and pushed the cart away. Okay.
Thanks, Michelle. We appreciate you catching that.
That speaks to the importance of signage, though. You know, I've always felt this, that infection control is a lot of successful low-tech interventions. And it's amazing to me, during the COVID, during the height of the pandemic, and I was working in the hospital, and part of our job was to make sure the signs were, appropriate on the door for isolation in general. And of course, with COVID, we weren't able to do that as frequently as we wanted to. And it created such havoc. It just reminded me that, those things that you think aren't so important are really, really important.
Yeah. Okay, can we go to the next slide? All right, just because the staff member signed the in-service sheet does not mean that they understand the full impact of the reason for using PPE. And there are folks who believe the signs are only for nursing staff, and since they're not providing care, the sign doesn't apply to them. And also, knowing how to put on, remove, and discard PPE is only step one. The facility staff should understand that PPE prevents the spread of infection. It applies to everyone. And facility staff should be alerted to non-staff who may unknowingly cause the spread of infection through their actions. And next slide. So do the staff have the resources to provide education to visitors of residents who are on precautions? And then here are two sites. One is from APIC and CDC. It's a MRSA resident family information page. And the second one is the CDC Clean Hands Count campaign. So they're good resources to give to your staff, to give to visitors of residents. Next slide. And then here's some education sites for staff. And this is through CDC Project First Line. And I think Josh is putting that in the chat. There's one that's called Germs Live on and in the Body. And there's posters and some explanations on that site. And there's another one called Recognizing Infection Risks in Healthcare. And there's a little, almost what I was doing here, like, is this okay? And what should you be doing? And then next slide. And some other sites, how we have a resource library, an IPRO resource library, and we have, it's about 7 slides, and it's how reliable are your infection control processes? And then an infographic from APIC, breaking the chain of infection. And next slide. And here's all the things that you just couldn't wait to see about personal protective equipment, protecting healthcare personnel, donning and doffing, things that you might have seen already, but maybe need a refresh on the handouts or packets. And that's the end.
Do we have any questions? Anyone wants to put anything into chat? Feel free to unmute yourself or put anything in the chat. We're here to answer any questions you might have.
One idea, Kelly and I wanted to share with you, a colleague of mine had just done, because her staff had PPE fatigue, what a surprise. And instead of just, doing a skills fair, an education session where she had them don and doff the PPE, and it was a time thing. She had other things she wanted to do. She actually made like a little figure with mini PPE and toothpicks and asked the staff to, okay, this is the scenario. Move the PPE with the toothpick, into place where you think the PPE should be. So it was kind of, she said they really loved it, which, she was a little hesitant at first because she said, oh, they're going to think this is silly, but they really liked the idea of talking through it and doing something besides having to stand there and don and doff. So it's just, another innovative way to reinforce this information, not only in putting on the PPE, but taking it off carefully so you're not, harming yourself or contaminating yourself with unsafe doffing practices. So it's such a challenge, especially in this pandemic weary world we're in right now. But I thought that was interesting, and I love the scenarios you put up.
Right. Yeah. And I'm thinking that might be a good way that as you're having to readdress infection control, that using a scenario approach might be beneficial, and you could do a different scenario for different groups of people.
Yeah.
All right, well, I put all the links to some of the resources into chat. Feel free to check that out. We did get a question from Fawn just now. What do we do if outside ancillary services are in the building and staff are required to have masks and goggles, but the ancillary services, I think they're referring to, are only wearing masks?
I think it depends on the type of isolation. Is this standard that you wear masks and goggles for all care, or even if it's non-direct care for patient or for residents?
Well, and again, sometimes this is state specific, but what I know is that in facilities, they're still required to wear masks. And I'm just trying to figure out outside ancillary services. Are you talking about like a maintenance person coming in, or phlebotomist, a dental? That's odd. They're only wearing masks and not goggles. They should be wearing goggles in general anyway.
All the time, that because their work is
that's high splash.
Yeah, it's high risk. So I guess, and to Arlene's point, if it's state specific, because I think if it's policy that they're needed, then does that mean the facility is obligated to provide them? I don't know. You know, when you're talking about that, it gets challenging with who's responsible for that, but they would be
right.
They would be the most high risk, that they should be wearing it anyway.
Right. If it's a dental service that the facility has a contract with, then I think it should be part of the contract that they have to provide their own PPE. But if the facility policy is that everyone has to wear mask and goggles, then the contract agency should be doing the same thing that the facility's doing.
That might be a conversation between leadership and this contracted group, because in my mind, it's no different than, they're required to have certain immunizations to walk into your facility. So it would be on the contracted agency to provide that for them. And they I don't know. I don't know what the proper channels are, but
yeah, I mean, this is definitely something to have a conversation with your administrator, because you having someone coming in for dental to provide direct patient care, they should be following the same PPE protocols for that resident as the staff. If I would definitely speak with your administrator about this, or if you're the administrator, I would speak with that contracted dental service. Who was an assistant who was gathering residents. Okay.
Right. But again, if it's a contract agency and not something that was arranged through the resident family, well, still, even then, they should know what the protocol is for the facility, and everyone should be following it. So again, I think just like we were talking about, maybe you're not the right one to tell the surveyor that they need to not go into another room. You want to bump it up a little higher. Like Josh said, that would be a conversation you should have with the administrator. And then the administrator could contact whoever the total contract was from and explain what's going on.
Yeah, that's a challenging one. And goggles are, I think, the most challenging of all PPE, regardless, whether you're dealing with your staff or contracted staff, agencies coming in. And, it's a risk for passing contagions, but quite honestly, it's a risk for that healthcare worker, because they're getting exposed directly.
Right. And again, it's the not me.
Yeah.
I don't have to do that because I'm not
at risk.
On staff.
I'm not on staff. I'm not.
Even though they're seeing everybody else with it on.
Exactly.
Well, I have our contact information up, sharing on the screen right now. Please feel free to reach out to us if you have any other questions or need any additional support with your quality improvement initiatives. We're going to be wrapping up the session now. Before you leave, if you could just put into chat if you thought today's session was beneficial, good use of your time. We understand that, PPE education has been gotten a little redundant, the past couple of years, going over the same information. So we hope today's session going over these case scenarios and providing some more critical thinking about, what actually should be done and why we should be doing it was beneficial. So again, just let us know in chat if you liked the session today, if you thought it was helpful, and then we'll be closing out this session. Thank you so much, everyone.